In this video today, I'm going to give you 5 reasons why you may be having nausea and what you can do about that. For those of you who are joining me today for the first time, my name is Dr. Samir Islam. I am a board-certified poop doctor. Yes, there's an actual job practicing here in Texas. My passion is to give you tips and tricks to help out with your gut health. Every Thursday around this time, I try to give you one poop bomb to help out for your gut health. If you like these videos, I would encourage you to subscribe to my page. And for any questions or concerns, comment down below on the description where I give you more information about what we can recommend to help out with your gut issues. But today's topic will be 5 reasons why you have nausea. Now, nausea and vomiting is a very common symptom to have. A lot of people have these issues. And what I tell my patients is that it can be due to a lot of different reasons. It's hard to pinpoint exactly what some of the causes are, but in today's video, we'll talk about the 5 most common causes for reflux. Number 1, anxiety. Anxiety for a lot of people can be manifested as nausea and vomiting. And there's a very significant connection between the brain and the gut. So for a lot of people who have nausea, it actually may be related to your anxiety or depression or even some sort of mental health issue. And so if you feel like you're having some of those issues, it may be best to address that with somebody who specializes in mental health. The second most common cause for nausea is actually acid reflux. Now, acid reflux may present in a lot of different ways. For some people, it can be burning, regurgitation, maybe some pain, but there are a significant number of patients who actually have nausea as one of the symptoms of acid reflux. And so if you're suffering from nausea and you're wondering if it may be due to acid reflux, try taking an over-the-counter acid-reducing medication to see if it helps out with your nausea. The third reason why you may be having nausea is your gallbladder. Now, the gallbladder can cause a lot of different issues for a lot of people. Pain, nausea and vomiting, upset stomach. Sometimes it's hard to pinpoint if it's due to your gallbladder or not, but usually if you have pain on your right upper quadrant, right side, with associated nausea and vomiting as well, that combination can be a sign of a gallbladder issue. So if that is the case, make sure you speak to your healthcare provider about getting your gallbladder checked out. The fourth reason why you may be having nausea and vomiting are medications. There are a lot of medications that have side effects within the GI tract. And some of the most common ones are pain medications. So things like Loratab, anti-inflammatory medications, things that have codeine. These can really affect the GI tract by slowing things down, causing ulcers to occur, and causing symptoms of nausea and vomiting to occur as well. So if you're having these symptoms, you're on these medications, try to see if you can wean yourself off of that. Now, the fifth reason why you may be having nausea is probably a surprising reason, which is actually marijuana. Now, a lot of people think that marijuana can help treat nausea, and for some people, that may be the case, but in the vast majority of people, marijuana actually makes nausea and vomiting worse. There actually is a clinical syndrome called cannabinoid hyperemesis syndrome, which is a syndrome in which you smoke a lot of marijuana, but that marijuana actually increases the receptors to make you more susceptible to have nausea and vomiting. But people who have this condition smoke more marijuana to try and control their symptoms, which in turn makes the symptoms a lot worse. So it ends up being a vicious cycle with more and more marijuana causing more and more nausea and vomiting, causing you to smoke more and more marijuana in the hopes of treating that. And so the best treatment for this condition is to try and stop marijuana, because that will hopefully resolve your symptoms. I want to thank you guys for joining me today. I hope you guys thought this video was informative. My question for you today is, what do you think you can take from this video today, and what are some other things that you've done to help out with your nausea and vomiting? Comment down below. I'd love to hear what you guys had to do or what comments you guys have about this particular video. But I want to thank you guys for joining me today. Once again, every Thursday around this time, I try to give one Poop Tip Thursday where it's my poop bomb to help you out for the week. But I hope you guys have a great rest of the day. Thanks and take care.